So okay, good day to everyone. I'm Johnny Balmeo, your clinical instructor for this subject. So today we're going to have a little demonstration regarding the initiating a peripheral venous access IV infusion or simply as IV cannulation. So today tuturuan ko kayo kung paano ang pagkakanula. Okay? So first of all, you need to know what is our goal. So ano ba ang goal natin dito? As much as possible, we need to insert the access device, this one, okay, on our first try or first attempt using a sterile technique. Okay, so what else? We have to check for our equipments. So number one there will be the appropriate short peripheral IV catheter or yung ating benepuncture. For our benepuncture. Okay, so this one, ito po ang gagamitin natin. Okay, so this is, as you can see, this is color blue. Okay, so anong gauge ito? Okay, do you guys still remember the color coding that we discussed last time? So if you're not familiar with the color coding, okay, you can check for the wrapper. So dito sa likod, makikita ninyo kung anong gauge number po siya. So this one, as you can see here, this is gauge 22. Asan na yun? Yun, gauge 22. Okay, for the color blue. Okay, I have here ito ang gagamitin ko later. I have here color pink. Okay, so I have here the cannula na gagamitin natin or the peripheral IV catheter. Next one is the IV start kit supplies. Okay, usually po dito sa may Pilipinas hindi po available, but sa other countries available siya, kaso nga lang very limited din po yung supply. So if hindi available to sa institution na pupuntahan ninyo, ikaw na bahala na mag-prepare. Okay, ikaw na bahala mag-prepare individually. Okay, so ano ba yung laman ng kit na yan? So number one there, contain the sterile drape. So usually hindi naman na kami gumagamit ng drape sa hospital. Okay, hindi na kami gumagamit po niyan. Okay, ang ginagamit na lamang namin na drape dito is of course the hospital drape, or should I say, yun as may word mo for the privacy. Okay, what else? Ano pa ba kailangan natin dito? Yeah, okay, we're going to use also the tourniquet or the tourniquet or tourniquet, either of the two, same pronunciation lamang din yan. It is just a piece of rubber. Okay, it's just a strap, a wrapper. Okay, pero yung ibang institution, they have a device na garterize. So either of the two is acceptable, pero mostly ito yung makikita ninyo. Kapag hindi available itong tourniquet na to, so we improvise. So ang ginagamit namin sa may hospital, kapag hindi available to sa may unit namin or emergency, ginagamit namin. Okay, nursing is an art, ka nga. So ito po yung ginagamit natin. Okay, ginagamit namin. Okay, yung medical gloves mismo. Okay, so we can use this one. Pwede naman itong gamitin as, what do you call this one? As a tourniquet. Okay, so ano po yung kailangan natin maliban dito? We're going to use also the tape or the micropore. Of course, this one will be used for the dressing. Okay, kung hindi man po available, gamitin tayo ng ating transparent dressing, the Tegaderm or ano tawag dito, transparent film. Okay, I already told you guys saan ito ginagamit. Pwede rin natin gamitin for the IV dressing. Okay, so hindi lahat po ng hospital meron pong transparent film. Okay, or the transparent dressing. So in that case, gagamitin lang natin is the micropore. Okay? So sa may micropore, kailangan mo lang dito mag-cut ka rito ng 5 to 7, it will be enough. Okay? 7, 8, or 9 will be enough. Okay, I already made pre-cut here, and as you can see here, I already made the pre-cut here. Okay? So before ka mag-cannulate, mag-pre-cut ka na, gumupit ka na. Okay? Ahead of time. Para sa ganun, smooth na lang ang maging flow ng iyong cannulations. So, dito, about lamang to, 4 inches lamang yung length na to. Okay? 4 inches lamang yung length. Okay, nung ating, what do you call this one? Ating micropore na gagamitin. Pero I want you guys to see this one. Okay? Lapit lang ako. Okay, there is one micropore there na kailangan ganito ang gagawin mo, no? Okay, yung sticky areas nandito sa may part na ito. Gagawin mo itong nasa taas, itong top portion, medyo mo siya, itupi mo. Okay, about lang to, maliit lamang itutupi mo sa may pinakadulo. Okay, technique to na ginagawa natin, mamaya malalaman ninyo para saan po ito, kung bakit tinupi ko siyang ganyan. And then of course, dikit mo lamang siya sa may gilid. Okay, kaya mo lamang siya dyan kasi mamaya pa natin gagamitin yan. Okay, so I have here, prepared here already, about 2, 4, 5 micropore na gagamitin ko for the dressing. So aside from the tape, ano pa kailangan po natin dyan? Ano pa ba kailangan natin? Micropore, transparent film. We're going to use also cleansing agent. Yung ibang hospital, Clorox din yung ginagamit nila. Pero kami na hospital, alcohol will be, alcohol will do the job. Okay? Alcohol will do the job. So I have here, okay, alcoholized naman na itong dalawa na to. Pero isa lang actually will be enough. Okay, kahit isa lamang po dyan, enough na yan para malinis natin yung site kung saan tayo magkakanula. Okay? So what else? Yung ibang institutions there using povidone iodine, pero okay, ang povidone iodine kasi ang problem dito is nagkakasto ng staining. So kailangan pang i-cleanse yan. So medyo madiwara kung ang gagamitin mo is povidone iodine. So chlorhexidine or kaya naman alcohol, it will do the job. Okay? Kahit alcohol lamang po yan. What else? 2x2 na sterile gauze, pero ako rito, ang prepare ko is only 1x1 na, ayan, nakikita niyo ba sa may video? Okay, na gasa. Okay, this one. Okay? So mamaya malalaman niyo para saan ba to, bakit kailangan pa natin na to, magde-dress ba tayo, gagamitin ba to para sa may dressing. Later on, I'm going to tell you para saan po ito, okay? So what else? We have the, what you call this one? The gauze pads. Next will be the sterile, or no, hindi tayo gagamitin ng sterile gloves. Clean gloves will be enough. Okay, clean gloves or the medical gloves will do the job. What else? We're going to use also some extension set with a needleless connection device. Okay, or tinatawag din po ito ng iba na hep lock or the saline lock. Okay, or kaya naman tinatawag din natin ito na IV plug or adapter. So is it really necessary? Hindi po. Okay, optional lamang po ito if it's really necessary. And also, it depends doon sa may order po ni Doc kung gagamit po tayo ito ng heparin lock or etc. Yung mga needleless connection devices natin. So you can see here, I don't have one. For what reason? Kasi hindi ko naman siya kailangan. Okay, what else? 5 ml na syringe. Okay, gagamitin natin ito. Kailangan pre-filled na siya ng 5 ml. Gagamitin natin ito as a flash agent. Sir, is it really necessary? Guys, hindi ko po tuturo kung paano ito ginagawa. For what reason? Kasi hindi naman namin ito ginagawa in a hospital. If you wish to perform this one, why not? Po pwede mo siyang gawin. Okay, you can do that. But again, in the hospital, we do not do that. Hindi po namin siya talaga ginagawa. Okay? So, basically, para sa po ba yun? Eh, nagpa-flash tayo para lang maklear yung blood na nandun sa may cannula na naka-insert. Okay, at the same time, para malaman natin na wala talagang infiltration. But there are different ways naman kasi para ma-flash yun. And there are different ways para malaman natin kung mayroong infiltration na nagaganap. Okay, mamaya tutulong ko sa inyo yan, some technique. Okay, technique, not techniques. Okay, what else? So if we have a pre-filled 5 ml syringe na gamitin na sa flash agent, gagamitin po tayo ito ng alcohol pads. So is it really necessary? Hindi naman. Okay, sabi nga sa'yo, the cotton balls na merong alcohol, it will do the job. Okay, what else? We're going to use also stabilization device. Optional lamang po siya, okay? Optional lamang for what reason? Hindi po lahat ng pasyente nilalagyan natin ng, what do you call this one? Ng stabilization device. Okay, ano po ba yung stabilization device? Okay, nakita niyo ba sa may video? This is a stabilization device. Or mas kilala as what? Splint. Yan yung nilalagay sa may kamay na sa ganon. Okay, flexion, extension, okay, malilesen po yan. Okay, sisecure yan using the Velcro tape. Okay, using the Velcro tape. So kapag ang pasyente natin is combatant yan, medyo malikot. Okay, what else? Kung ang pasyente natin is mga baby, kasi yung baby, likot ng likot. So there's a possibility na matanggal yung kanilang IV tubings. Okay, there's a possibility na ma-remove yung IV tubings. So to prevent that, okay, naglalagay po tayo rito. Okay, ng splint. Okay, Velcro tape, ang ginagawa namin in the hospital kapag wala kaming ganito, okay, we use yung carton lamang. So tinutupi namin yung carton. Okay, then lalagay namin dito. And then tatalian na lamang namin yung walang Velcro tape, we will use, of course, micropore ang gagamitin namin. So nursing is an art, teka nga. Nursing is an art. So kailangan, we need to improvise things na hindi po available. Okay, so ginagawa po talaga natin yan. And also, skin protectant kung kinakailangan, especially sa mga pasyente natin na mayroong allergy, okay, sa mga tape or kaya naman sa mga ganitong devices. Okay, what else? Prescribed intravenous solution, kung ano po yung order ni Doc, yun lamang po ang ipiprepare po natin. So I have here, I do not know, nakikita mo ba sa video, I have here the glass one. Okay, this is actually mannitol. Okay, so I have another one here. This is 500 ml, so you can see the color red. This to remember, color coding natin. So it's a color red. So ano po ito? Okay, this is different water. Okay, I have here, yeah, color pink. Yeah, this is pink. This to remember the color coding. Yeah, this is what? This is D5LRS. And I have another one here. Okay, dark blue. Okay, which is what? The plain LRS. Okay, very good kung naalala niyo pa. Okay? So, you're gonna need also the prescribed IV solutions. Kasi hindi po pwede basta ka na lang magpiprepare kung hindi naman yan yung prescribed by the doctor. Okay, what else? Administration set na gagamitin din po natin, or should I say the IV tubings. So, ganito po ang itsura ng ating IV tubings. Ayan. So, sterile po ang loob natin. So, andito po yung tubes. So, ano yung itsura niya? Pag tinanggal, ganito, no? So, itong dulo na to, this is the spike. I already discussed it to you guys before. This is the spike, this is the drip chamber. Okay, the tube end. Okay, itong i-connect po natin, ano? And meron yung cup. Okay, ito yung i-connect natin doon sa ating, what do you call this one? Sa ating cannula. Okay, doon sa may IV cannula. Okay, then of course, ito namang isa na itong spike, ito yung ipapasok natin doon sa ating IV solutions. Okay, so later papakita ko sa inyo kung paano natin gagawin ito yan. Okay, so what else? Ano pa kailangan natin? So be sure na kung ano yung order nito, is it macro or micro? Yun yung ipiprepare mo, no? So alamin mo, is it macro or micro? So usually kapag ka-adult yan, macro set ang ginagamit natin. Kapag ka po yan ay mga pedya, micro ang ginagamit natin. Usually sa 500. Pero tawag dito, huwag ka mangungula of course. Okay? Double check the order of the doctor. Okay? Kung hindi available yan doon sa may order ni doc, you can ask doc. Okay? Pwede mo naman tanongin si doc or make a follow up nung kay doc. Okay, what else? So, the tubings, ano pa kailangan po natin? Some protective equipment, katulad ng goggles or kaya ng mask. Pero is it really necessary to wear those things during the IV cannulations? Hindi naman po. Not unless, ang duty mo is nasa may COVID ward, medical ward, kung saan meron talaga ng mga contagious na mga sakit. So, you really have to. Okay, next one, gagamitin po tayo ito ng ating IV pole. Okay, so ito po yung IV pole na gagamitin natin. Pero in some other hospitals, meron silang ceiling mounted. Nasa taas po, nakakonect po yun. Okay? So don't forget so usually naman every bed meron sila nasa gilid na mga IV pole or the IV stand. Okay, next one, EID kung available, mga electronic infusion devices. Kung available lang naman, kung hindi available, wala tayong magagawa. Walang problema doon. Okay? Next, we're going to use also watch, okay, with a second hand. Para sa for the calculation ng ating drip rate. Okay, next one, gagamitin po tayo rito ng mga patient's gown, pero usually ang patient's gown kasi sa ER pa lang yan, ER or sa may admission, okay? Or ganun pa, once na dumating ang pasyente na sa may ward, napalitin na kagad natin yan. Next will be the needle disposal container. So for this demonstration, ang gagamitin ko po is, for now, is only the kidney basin. Okay? So there's a reason kung bakit kidney basin ang gagamitin ko later. I'm going to show you guys bakit kidney basin. Okay? So that's it for the different equipments na gagamit natin for this procedure. Now, we're ready to perform the implementation. Let's move on now to the implementation phase. Okay, so for the implementation, saglit lang. Sub ko lang. Of course, you have to verify the IV solutions na gagamitin mo dun sa may chart ng pasyente po natin. Sa may medical record niya, kung ano ba talaga yung gagamitin natin. We're going to use the plain LRS, the FAB LRS, the water, or any other solutions. Okay, double check mo, verify the order of the doctor. Okay, what else? You have to clarify the inconsistencies kapag ka ang pasyente mo mayroong diabetes mellitus, tapos nag-order si doc, nag-order si doc sa'yo ng D5 LRS. So parang maka-question ka na, or am I going to give the D5 LRS my patient ko na may diabetes mellitus? So if you're very unsure with IV solutions, you can ask your doctor. Okay, I mean, you can ask yung doctor na naka-duty on that day, okay, doon sa my patient ninyo. You can ask him. Okay, what else? Check the patient's chart then for any allergic reactions or allergy. Okay, especially dun sa mga sa mga foods or sa mga gamit na gagamitin natin, medications. What else? We have to check also yung solution natin mismo. Okay, for any color. So usually ang mga IV solutions natin, clear lamang po yan, okay? Clear lamang yan. Okay, even the mannitol, as you can see, it's like a water. So clear lang po dapat yan, walang discolorization. And of course, you can also check for the leaking, tulad na to. D5 LRS, medyo luma na to. As you can see, nagkakaroon ng leak. Okay, so i-dispose mo na kapag kaganyang merong leakage. We cannot use this one. Okay, what else? You can also check for the, what do you call this one? The expiration date. Makikita mo naman yan sa may sticker na nakalagay dito or sa may wrapper natin. As you can see, dito, nakasulat manufacture date, expiration date, and even the lot number, sub-lot number. Okay, so makikita niyo dito yan. Okay, double check. Okay, double check niyo parate. What else? You also have to check for the some, or should I say, know some techniques regarding the IV cannulation or IV insertion. So dapat familiar ka sa mga different techniques kasi hindi naman lahat ng pasyente pare-parehas ng ugat. Okay? Magkakaiba po tayo ng ugat. Okay? Lalo na kapag ang pasyente mo bata, baby, ang hirap po nun. Okay? So you have to know the different techniques for the IV insertion. Ano pa? Some precautions. Okay? Ano pa? What's the purpose of the IV administrations? And of course, kung merong medications na gagamitin or i-incorporate dito. That's why I have here, yan, nakapag-prepare na ako rito ng medications. Yan. Okay, baka gagamit kayo ng medications dito. Of course, you have to prepare it also ahead of time. Okay? I mean, tawag dito, i-prepare mo na siya. Okay? What else? Gather all the equipment na gagamitin po natin. Okay? Bring it to the bedside table, as you can see here. Okay? Nakaprepare na yung mga gagamitin ko. Okay? Ano pa ba? If you are now ready, na-secure mo na lahat, perform hand hygiene na. Okay? Perform the hand hygiene, and if it is necessary, you can now put on your PPE if indicated. So sir, maglalagay na po ba kami ng gloves ngayon? Hindi pa. Mamaya pa. Okay? Mamaya pa. Why? Because hindi ko pa natin ipiprepare ang ating IV solution. So huwag ka muna magka-gloves. Okay? Kung ikaw ay nasa may hospital, na-prepare mo na lahat, pwede ka na mag-gloves. Pero sa ngayon, huwag muna. In this demonstration purposes, huwag ka muna mag-gloves. Okay? So what else? Identify mo yung patient mo. I already told you guys. How will you able to identify your patient? Paano mo ma-identify yung patient mo? Sabi ko na yun before. Okay, there are different ways. Next one, provide privacy to your patient. And also, ask your patient for any allergy sa may gamot. Although, sa may admission pa lang, tinatanong na to. And also, para ma-double check mo din, you can check yung chart ng patient. Okay, nakalagay naman usually doon kung meron siyang allergic reaction sa medications or sa may pagkain. Okay? And what else? If you're going to use a local anesthetics or local anesthetic drugs, kung magpapahid or mag-i-inject ka man, you have to explain that to your patient. Explain that to your patient kung bakit gagamit ko yun ito. Pero Philippine setting, guys, here in the Philippines, it's very rare. Actually, tagal ko na nag-hospital, di ba? Even in abroad, I went in abroad before as a nurse. Unfortunately, hindi pa kami gumamit ng gloves when it comes in the IV cannulation. Okay, gumamit lamang kami ng anesthesia, Okay, I'm sorry, anesthesia, hindi kami gumamit ng anesthesia. Okay, gumamit lamang po kami ng anesthesia during the IG catheterization. Saan? Dito pinadaan. Okay, yung kanyang suero. Okay, in that case, gagamit talaga tayo ng anesthesia. But for the peripheral, pagka dito, it's not really necessary to use anesthetic drugs. Okay, so once you already prepared everything, we will now move on to the preparation of the IV solutions and the administration set. We're going to prepare this one now. Okay? Okay, 3, 2, 1, action. Okay, next, compare the IV container. Okay, compare mo ito dun sa may chart ng patient kung ito ba talaga yung gagamitin, tama ba, even the expiration date. And then label the solution container with the patient's name, the solution type, additives, date, and time. So, in hospital, usually, naglalagay kami rito. Okay, nagdidikit kami rito ng maliit na tag. Okay, sa may tag na yun, nakasulat puro yung name ng patient, the bed number, anong oras ka nag-infuse, anong oras siya matatapos. Kasi kinukompute din natin yung duration. Dapat kung 8 hours siya, dapat after 8 hours, maubos mo yun. So, nilalagay din namin yung time doon. So, we are very specific pagdating natin sa may hospital. Okay, what else? Expiration date, yeah. Additives or kapag gumamit tayo ng ibang medications para puro sa ating solutions. Okay, kapag naglagay ka ng ibang, if you're going to incorporate other medications here. Okay, for example, you're going to incorporate another dextrose. Okay, so lalagay natin yun. Or kaya naman, multivitamins, maglalagay ka dyan. Ilalagay din natin, susulat po natin yun. Okay, so huwag kakalimutan. Next one, you have to maintain a septic technique kapag nag-open ka ng packages. For example, this one. If you're going to open this package, maintain sterile technique pa din. Sir, medical gloves gagamit? Yes, gagamit, pero mamaya pa. So, paano po ito pag in-open po namin? Okay? Okay. There's two parts of this IV tubings na mahalaga na hindi mo mahawakan. Ano po yun? Okay. The end of the tube, kung saan kakabit natin ito dun sa may cannula ng pasyente natin, and also the spike. Kaya yung spike meron tong takip. Okay, so wala lang po akong takip ngayon kasi hindi ko pa binubuksan ito. Okay? So, wag na mong hawakan to, wag na mong hawakan to. Pwede mo lang hawakan ay ito. Okay, with your bare hands. But since naka-cup naman to, okay lang. Since naka-cup naman to, okay lang. Wag na mong i-open yung cup, not unless you're going to use it na. Okay, so maintain pa rin natin yung sterile technique sa pag-open ng ating mga packages. Okay, kung ito ay naka-pre-pack po ito, naka-package to, sterile technique pa rin. Okay, aseptic technique pa rin yung gamitin natin. Okay, so once na na-open na natin ito, okay, as you can see here, okay, pag na-open mo yan, be sure na yung roller clamp, ito po yung roller clamp, nakikita ba? Ayan, yung roller clamp. Okay, roller clamp, be sure na nakalock po yan. Para natin malalaman na nakalock. Okay, usually kasi naka-open yan. So, ang gagawin mo dyan is, okay, roll it down. Okay, roll it down. Kapag kaya na nasa baba na, na-roll mo na ito baba, meaning nakalock na po yan. Okay, so, you have to roll it down. Kailangan po nakababa po ito. Okay. Ayan. Next. Remove natin yung cap natin doon sa may spike. So, this one's the spike. Ayan. This is the spike. So, we have to remove the cap. So, unfortunately, I don't have a cap here. Ano? Okay. So, you have to remove the cap here. Okay. Remove the cap. And then, next one is yung ating IV. I-remove mo rin yung cap ng ating IV. As you can see here, yan. Meron tayo rito mga cap. Okay, pakita ko lang sa inyo, ha. Ayan. Ayan, mapansinin nyo bilog. Suotan kasi yan ang daliri para mas madaling tanggalin. Okay? So, remove mo na rin to, but, aseptic technique pa rin. Kapag ito ni-remove mo, okay, consider ito, rubber to, consider ito as sterile, so do not touch it. In some other institutions, they're being instructed to use an alcohol, and then itong alcohol na ito, lalagyan ito ng, the cotton balls, lalagyan ito ng alcohol, and then, kapag ka-open ng IV, okay, ng ating bottle, pupunasan pa yan. Okay? So, sir, do you recommend that? Hindi po. I do not recommend that. For what reason? Kasi pag inopen mo to, okay, considered as sterile na po yun. Okay, close yan eh. Okay, so walang makakapasok dyan ng microorganism. Okay, so ako personally, I do not advise that. Even yung sa may book ni Kosher, hindi siya nag-mention na kailangan mo tong linisin. Okay, kapag ka-open mo. Okay, no need. Kasi malinis naman po yan. Okay, so pagka-open mo yan, na-open mo na rin yung cup na to. Okay, na-open mo na rin yung cup ng ating spike. Tanggal yung cup. Next. Okay. Itutusok mo na siya ngayon dito. Okay. Tandaan natin ito, no? Twisting motion and pa-push. Pababa. So, lapag mo rito. And then, gawin mo rito. Yan. Twist mo. Para sa ganun, madali mo siya may pasok. And that's it. Okay? Naipasok mo na. Okay? Doon sa may container natin. Next one. Nakalak to, no? Next one. You're going to, okay, hang the IV container. Hang the IV container. Doon sa ating IV stand. Okay? Next, squeeze mo kahit halfway lang dito sa may drip chamber. Squeeze mo na sa ganun tumulo to, ma-fill ito ng ating IV solution. And then next, okay? Next. Okay? Kapag ka-squeeze mo, na-fill mo na to, okay? You now going to open the IV tubing clamp. I-open mo na siya. Okay. Open the cap. Na-open ko na yung cap. I-save mo lamang to sa may clean area natin. Okay? And then, itong kidney basin, itapat mo lamang siya dyan. And then, open mo yung roller clamp. Ayan, tumutulo na siya rito. And then, yan, papunta na rin siya dito. Sir, para saan po ito? Bakit ginagawa mo yan? Okay, what is the purpose? So, ang purpose natin dito is para ma-remove natin yung bubbles dito sa loob ng tube. Kasi kapag ito ay pinasok mo dun sa may IV, cannula ng pasyente natin, kasi may mga bubbles dito, delikado. Okay, kailangan na pumasok sa may patient natin is the IV fluids, not the air. Okay? Hindi po hangin ang papasok dapat. Kaya tinatanggal natin yung hangin dito. In order for us to do that, i-fill natin. Okay, open the roller clamp and that's it. As you can see, yan, tumutulo na siya. Kapag nakita mo na wala naman ng mga bubbles dito, i-close mo na muna. Okay? And then, i-recap mo. Kaya ganun na, huwag mong itatouch yung pinakadulo ng ating tube. Okay? Clamp mo yan, and then i-save mo lang muna to. Save mo lang muna siya. Okay? What else? So, after that, Ano pa ba susunod natin? You have to maintain the sterility of the tube. Okay, the fluid has been filled. Fluid has filled the tubes. Ano pa ba? Na-prepare na natin lahat. Okay, packaging. Okay, in that case, we're going to initiate the peripheral venous access na. Okay, magkakanula na po tayo. So for this demonstration purposes, I cannot use my own hands. Hindi ko siya madedemonstrate at wala rin po available na CI sa ngayon. Hindi pa sila dumarating or maybe, I do not know. Wala rin may gusto. Natatakot sila. So, for this demonstration purposes, ang gagamitin ko na lang is what? Gagamitin ko is, saglit lang. Saglit lang. I'm going to use this one, okay? Ng mannequin. Okay? So for this demonstration purposes, ang gagamitin po natin ay, since walang na may gustong magpa-suwero, ay gamitin na lamang po natin is this one. Okay? So we have here a mannequin. Okay, itong mannequin na lamang na ito ang gagamitin po natin. Okay, we call it the IB arm. Okay, unfortunately, medyo may kahirapan ng paggamit dito. Ang paggamit lamang din sa may IB arm natin is for the insertion. Pero if you wanted to see the backflow, medyo mahirap kasi mannequin lang siya. Okay, so usually hindi mo makikita talaga yung backflow dito. Okay, so yeah, let's start the initiation of the IV cannula. So as I have told you guys, ito po gagamitin ko. Okay, gauge 22. Okay, so prepare na natin dito. Handa na natin. Okay, medyo baba ko siguro to. Yan. Yan, nakita na. Okay. So, first of all, you have to place your patient in a low Fowler's position. Pero kung ang pasyente po natin is they are comfortable na naka-flat on bed, well, wag natin silang pilitin. Okay? Pero kung kaya nila, well, why not? Kasi mas madali po ang pagsusuwero kapag ang pasyente natin is naka semi-Fowler's or high Fowler's position. So, there's a rationale behind that. I already told you guys during our discussion. And then, you have to place a protective towel or a pad under the patient's arm. So, ito po ang gagamitin ko, no? Okay. Okay, so para saan po ito? Okay, again, this will minimize the spread of microorganism. Okay, it will prevent the spread of microorganism. At the same time, if ever na magkakaroon ng leak, not directly dun sa may pinaglalagyan or sa may armrest ng pasyente. Okay, at least meron dito na mag-absorb nun. Okay, so after this one, you have to continuously provide emotional support to your client. Okay, continue pa rin yung sa salita or pakikipag-usap sa may patient mo as much as possible, i-lessen natin yung kanilang anxiety. Okay, so talk to them, at least provide emotional support kung kinakailangan talaga. Okay, what else? You have to open the extension tubing package. We already did that one. And we already prepared the IV tubings. Okay. Next one, select and palpate for the appropriate. Nalilito ako sa camera. Pasensyaan nyo na, ang hirap ka mag-isa. Okay? Select and palpate for an appropriate site or veins. So in this procedure, okay, magme-metacarpal na lang siguro ako. Although ang IV arm natin, pwede po siya sa may cephalic, pwede rin siya sa may basilic. Okay, either of the two po pwede, pero I'd rather choose this one. Okay, magme-metacarpal na lamang po ako. Okay? What else? Okay, after inspecting, after palpating, okay, nalaman mo na saan ka mag-cannula, then, okay, assess mo naman kung medyo mabuhok dito. If ever na medyo mabuhok, makakasagabal yan dun sa ating IV cannulation. So, you have to at least clip it. Okay? Yung clipper, or dito sa Pilipinas, mas kilala siya sa razor. I-razor mo lang yan, or hitin mo man lang yan, kahit paano. At least 2 inches. Okay? Next one, dito ka pala magsusot ng clean gloves. Okay? Di ba kayo nasabi ko? Put on PPEs. Pero, since nagpe-prepare pa lang tayo ng ating IV solutions kanina, so hindi ko pa kayo pinag-gloves. Dito pa lang kayo mag-gloves. So after inspecting it, okay, after shaving it, after clipping it, okay, mag-gloves ka na. Okay, clean gloves will do the job. Next one, okay, apply a tourniquet or the tourniquet. Okay, apply a tourniquet. Okay, apply a tourniquet where? Okay, apply a tourniquet about 3 to 4 inches above the benefancurous site. So usually po kapag metacarpal or cephalic yan, just above the wrist, okay, doon ako nag-tourniquet. Okay, so sabi ko sa inyo, iba-ibang tourniquet natin, ano? Iba-ibang tourniquet natin. Medyo mahirap lagyan to at bumabagsak siya. Okay. So be sure lang na kapag naglagay ka ng tourniquet, it will occlude. Huwag masyadong masikip, huwag din masyadong maluwag. Okay? So yan, and this one will be enough. Hindi masyadong masikip, hindi rin masyadong maluwag pag naglagay ka ng tourniquet mo. Okay? At ang paglalagay ng tourniquet, as you can see, ganyan lang po kadali. Kaya parang sa ganun, isang hila lang dito, tapos na, matatanggal mo kagad-agad. Okay, again, ano? Isa pa. Medyo rumupok tong tourniquet eh. Ayun. Okay? So about 3 to 4 inches lamang naman yan. 3 to 4 inches. So sabi ko sa inyo, just above the wrist. Okay? Just above the wrist will do the job para mas ma-obstruct natin yung blood flow. So magkakaroon ng mas madaling feeling of blood dun sa ating veins. The next, instruct our patient to open and close his or her arms, or the hands. And then, observe and palpate for a suitable veins. So, lalaki to usually. So, naturo ko naman sa inyo the different techniques. Okay, the different techniques kung paano magpapadilate po itong ating veins. So, kapag nakita mo dilated na to, okay, next one. Cleanse the site with antiseptic solutions such as the paroxidine or it depends. It depends. Baka doon sa may institution na pinapasukan mo, what do you call this one? You're using povidone iodine or alcohol. Sundin natin yun. Pero pinaka-common talaga na ginagamit natin dito is the alcohol lamang. Okay? So, circular motion. Dito ako hihit Okay, next, dispose na natin to. Dito sa ating disposal container or yung ginamit ko rito, kidney basin. Okay, next, use your non-dominant hand. So, ang non-dominant hand ko po is kaliwa. Okay, kaliwa po yung non-dominant hand ko. And then, you have to place it 1 to 2 inches just below the entry site. So, kung dito ako magtutusok, itong kamay ko na to, kaya hawakan ko to, and then dito, binating ko yung skin. Okay, bibinating ko yung skin pababa. So, para saan po ito? You have to hold the skin taut against the vein. Nang sa ganun, mas madaling ma-expose yung vein kung magbabase ka rin sa may color, or kaya naman, mas madali makikita yung veins at saka, what do you call this one? Mas madali mong may papasok yung needle. Okay? So, yan. Hawakan mo, binatin mo, then avoid touching the prepared site. So, I already prepared this one eh. Okay? So, wag mo ito-touch yun Okay, tandaan about 1 to 2 inches just below the entry site. Ilagay mo yan pababa. Okay? Then ask your patient to remain still while performing the venipuncture. Okay? Saglit. Next. Okay? Tanggalin mo na, kunin mo na yung iyong cannula na gagamitin. Okay? Gauge 18. Tanggalin mo yung cap. So, ang ma-expose lang dyan is this one. Okay, so naturo ko naman sa inyo the different parts. Okay, sa loob niyan, we have the needle. And then ito yung pinaka-cannula natin, okay? The lumen. And then dapat, ayan. Ako kasi, personally, ganito ako mawak, You can also do this one. Ayan. Ganyan ang paghawak ko. Okay, next again. Hawak dito. Binatin mo. Okay, enter the skin gently. And then holding the catheter by the hub in your dominant hand. Ito. Okay? And then tandaan yung bevel dapat Okay? It should be bevels up. Okay? Bevels up. And then ang entry natin, about 10 to 15 degree angle. Okay? Ito yan. Medyo mahirap dito kasi mannequin lamang to. Okay? So kung pagbabasehan ko dito is via vision, medyo mahihirapan ako. So ang ginawa ko dito para ma-detect ko is palpation. So, ayan, medyo na-detect ko, napapalpate ko yung vein. So, located dito. Okay, based on my palpation. Okay? So, another technique that I want you guys to know is that kung ang catheter mo, ayan, ganyan kahaba, para malaman mo kung saan ka tutusok, okay, kailangan itong cannula, yung pinaka-tip, hindi aabot dun sa may wrist. Kasi pag umabot yan dito sa may wrist, flexion, extension, delikado. pwedeng mag-cause yan ng phlebitis later on. Okay, so, tansyahin mo, hanggang dito lamang dapat yung end ng iyong cannula. So, saan ako mag-e-entry? Dito. Okay? Dito ako mag-e-entry. Dito ako papasok. Okay? Again, hilahin ko. And then, dahan-dahan ng pasok. Insert the catheter directly dun sa may vein. Although yung iba, sa may side. Okay? Pero as much as possible, ako kasi talaga direct. Hindi rin sa may gilid, kundi direct dun sa may veins. And then as much as possible, sundan mo yung flow ng veins. Kung ang flow ng veins papunta ron, kailangan yung karayom papunta rin dun. Pag yan papalikong ganun, hindi mo mapapaliko rito. Mahirapan ka. Okay? So, sige, pasok na ako ha. Ayan, tansyahin mo hanggang dito. So, dito ako papasok. Okay, 10 to 15 degree angle. Ayun, pasok na. Okay, sir, paano mo nalaman na nag-entry or nakapasok na? Okay, paano mo nalaman na nakapasok na yung iyong karayom? Okay, simple lang, nagkaroon ng backflow. Medyo mahirap kasi makita yung backflow dito eh. Okay, lagay ko na tong gasa. Okay, pansinin niyo no? Itong ating flashback chamber, as you can see, naging color pink. That means blood. Okay, kapag meron ka na nakita na blood dito, okay, sa may flashback chamber, ibig sabihin lang nun, you already hit the target. What else? Isa sa masasabi natin that you already hit the target, kapag meron kang naramdaman, ito tinatawag natin na sensation of give. Yung parang smooth na yung pasok ng karayom. Kapag naramdaman mo yon, okay, na smooth yung pasok ng karayom, you already hit the target. And then, check mo yung flashback chamber. Okay? Kapag meron ng red dyan, meron ng blood, ibig sabihin nun, you already hit the target. 50%. Okay? Sir, paano po yun? 50% you already hit the target. 50% no. Pwede kasi yung nag-through and through lang yan. Okay? So, paano natin malalaman 100% na nakapasok talaga? Okay? Itaas mo ng konti. Okay? Yung needle. And then, tignan mo yung lumen dun, ano? Okay? Pag tinaas mo, saglit lang ha. Nakita ba sa my camera? Saglit lang. Ayan. Okay? Pag tinaas mo ito, okay, may expose ngayon yung iyong cannula. And pag tinaas mo, expose yung cannula, makikita mo yung blood papaakyat. Magkakaroon ng color red dito. Ano ibig sabihin nun? You already hit the target. Okay? Nahit mo na yung veins. So in that case, okay, naramdaman mo na, meron ng flashback dito, okay, meron ng flashback, you already hit the veins, so what's next? Okay, what's next? You will now remove the tourniquet. So naka-maintain ka dapat dito, no? Okay, balik tayo ha. Okay, yan, nakapasok na may flashback, meron na tayong, what do you call this one? Backflow ng dugo. Okay, next, hold still and then i-open mo na itong ating tourniquet. Next. Okay, so after removing the tourniquet, okay, gently i-push mo forward ang iyong catheter and synchronously nire-remove mo dapat ito. Okay? You're going to remove this one. Parehas ano? So, as you can see here, push ako. And then itong needle, medyo naiiwan. Hindi ko kasi pwedeng i-push itong cannula na nakapasok itong needle. Bakit? Pwedeng mag-through and through yan. So, dapat nilalabas mo siya. And that's it. Okay? And then, as you can see, hindi pa naman tumutulo, ano? Kasi hindi pa nagkakaroon ng opening. Pero pag tinanggal ko to, ayun na, tulo na. Okay? So, pinakita ko lang sa inyo. Okay? So, while doing this one, ang ginagawa namin sa may hospital, bago namin ilagay itong IV tubings, okay, bago namin ilagay itong IV tubings, we press this area. Ito, itong area na ito, pe-press namin. For what reason, sir? Para ma-occlude natin yung veins. Okay, para ma-occlude natin yung veins dito. Sa ganun, walang maging backflow pag tinanggal natin ito. Unfortunately, mannequin po ito. So, as you can see, kahit i-press ko yan, meron pa rin lalabas. So, I cannot do that. Kasi nga, mannequin po ito. Okay? So, anong gagawin ko rito? Okay? So, what I'm going to do is, so, totoo lang, mas mahirap pang mag-insert ng catheter dito. Kaya sa totoong tao. Mas madali pa sa totoong tao. So, yeah, pinapress namin dito. And unfortunately, mannequin lang to. Kahit na i-press ko ito to occlude the veins, may backflow pa din. Okay, so, ang gagawin na natin, mabilisan na lang ano. So, immobilize mo lamang muna ito. Okay? And then, using your one hand, i-open mo na yung iyong, tanggalin mo, yung cap dito sa ating IV tubes. Or kaya naman, if you have an assistant, okay, you can ask him. Okay? And then, kunin mo na ito kaagad. Okay? And then, occlude dito para pag tinanggal mo ito, okay, walang backflow. Kaso nga lang, since mannequin po ito, kahit na-occlude ko siya dyan, meron pa rin backflow na mangyayari. Okay? So, let's just assume, ayun. Yan. Okay, gently push it, then that's it. Okay? If you have an extra gauze, well, why not? Para ma-dry natin to, no? For those backflow. And then remove mo, if ever na merong mga blood yan, okay, pakitanggal na lang ano. Then next, okay, we already inserted this one. Okay, next one, we're going to secure it naman. Okay, sisecure na po natin ito. Okay, tandaan natin ano, sa may pagsisecure, there are different ways ng pagsisecure, or should I say, yung IV dressing. So kung sa institution ka, yun ang susundin natin. Some other institutions, they use Tegaderm, transparent film, while most of the institutions, they use what? They only rely dun sa ating mga what? Okay, as you can see this one, micropore. Okay, so papakita ko sa inyo ngayon is yung paggamit ng micropore. So, ano natin gagawin? Kunin mo yung unang micropore and then yan ididikit mo dito sa pinaka-taas. Okay, dispose ko na pala muna itong needle. Okay, pinakataas. Next one. Okay, naalala pa, itong tape na to, yung merong nakatupi. Naalala pa? Okay, ipasok mo siya dito. Okay, yung tupi niya, yun ay pasok mo. And then, yung dikit niya nasa may taas. Next one. Okay, teka lang para mas madali ninyo makita. Ayan. Okay, next one. Okay. Itutupi mo siya, paakyat. Ganito mangyayari. Ayun. Yung isa naman. Ayun. So, para siyang letter V. Okay. So, sir, bakit mo ginawa yung FAB na yan? Okay, that is to give a securement, okay, or security, dun sa ating wings. Okay, wings netong ating cannula. Para sa ganon, naka-anchor siya dito sa may unang tape. Next one, kuha ka ng another tape. Okay. Tape mo naman itong taas na to. Okay, para sure na sure tayo. Naka-anchor talaga siya. Next one. Dito naman. Then next. Dito. Okay, para secure talaga. Okay. Ngayon, kung kukulangin ka ng tape, well, pwede ka naman magdagdag. Okay, in some other institutions, sinisecure nila ito, itong dalawang wings, and then maglalagay sila ng transparent film. Okay? So, what else? So, after this one, after mo ma-secure ito, okay, you can use a transparent dressing. Okay, pwede kang gumamit nun kung yun ang meron sa may hospital ninyo, or this one. Then next, sa may IV dressing natin, you have to write down some informations. Okay, the date, the time, the site, and type and size ng catheter na ginamit po natin. Pero here in the Philippines, hindi po natin yun masyadong ginagawa. Okay, sa tagal ko na rito na nagtatrabaho sa may hospital, hindi po namin ginagawa na nilalagyan namin to ng information. Instead, i-chart namin yun. Okay, sa may chart na lang namin nilalagay kung saan kami nag-tusok. Okay, anong site yun? Metacarpal ba yan? Cephalic, basilic, the date, the time, and even the size of the catheter. So after this one, secure mo naman na. Okay, don't forget din na i-secure mo itong isang tube na to. Okay? So, paano po ang pagsisecure dyan? Okay? Halos katabi lang yan. Payu mo lang siya. And then dito, okay, maglalagay ka rito ng another tape. Okay? So, mag-cut po tayo. Ayan. Okay, and that's it. Okay? So, para saan po yan? So, parang sa ganun, the purpose of this one, the rationale kung bakit naglalagay pa tayo rito ng another tape. Okay, naka-U as you can see. Ayan. U. Okay, this is for the security and at the same time, to anchor the tube na sa ganun, dito basta-basta mahihila. As you can see, ayan. Hinihila ko, hindi siya basta-basta may hila directly dito. Okay? Ang pressure niyan andito muna. Okay? So after this one, okay, after this one, pwede mo nang tanggalin yung iyong gloves. Okay, remove the gloves. Saglit lang magpupunas na lang. You may now open the clamp. Okay, pwede mo nang i-open yung clamp natin and then see the flow rate and begin the flow with infusion. Okay, open mo na yan and then mapansin niyo, okay, tumutulo na siya. I don't know if it is visible in our camera, pero let's see. Ayun. Yan, tumutulo na. Okay, meaning to say, yan. Meaning to say, okay, meaning okay na po yung flow, okay? That is another way para malaman natin kung walang infiltration na naganap, okay? Smooth ang pasok ng ating IV. Okay, kapag meron ka nakita nito na nagda-drops na yan, that is one way para masabi natin na, uy, I have inserted it correctly. At saka walang infiltration na nangyari. Okay, if you did that well, that's a good one. Okay, again for the what else? For the paglalagay ng dressing, the IV dressing, you can use 5 to 7, pero ako kasi minsan 5 will be enough. Pero yung iba, maabot pa ng 10 or 12. Okay, para mas maging maganda yung security o yung paglalagay ng, or should I say the dressing. Okay, and also, iba gumagamit talaga ng transparent film. Okay, yan. So what else? Saglit lang, ayusin kay camera. Okay? Or kaya naman, pagka napansin mo yung patient is medyo combatant or kaya naman bata, you can actually use, okay, ito na pwede mo itong gamitin. Okay? Again, may velcro tape po tayo rito. Kung walang velcro tape, we can use micropore naman. Okay? Or kaya yung mga pantali na meron available dun sa may unit po natin. Okay? So you can use the stabilization device na meron dun sa may area ninyo. Okay? Then explain to your patient the purpose kung bakit ka gumamit na to, no? Okay, mas maganda kasi talaga kung meron ganito, lalo na sa mga matatanda or medyo combatant na mga patient. Okay? And explain mo sa kanila bakit ka gumamit ka na to. Sabi mo sa kanila that this one is being used for the safeguarding the site. Okay, sa ganun ma-prevent natin yung phlebitis, infiltration, etc. Okay? So, after that one, remove equipment and return the patient to the position where he or she is comfortable with. Okay, then after that, remove mo na yung any additional PPEs na ginamit mo, if ever gumamit ka dyan ng goggles or anything. And then, perform hand hygiene, linis ka ng kamay, and then document mo kung ano yung nangyari. So, ano ba yung mga dapat na i-document natin dito? Document mo yung solution na ginamit. Okay? What else? Anong site? Metacarpal. Okay, anong gauge ang ginamit natin? Gauge 18. Okay, what else? Anong time ang infusion natin? And then, of course, ilagay mo rin dito, okay, the time, kung kailan, the duration, anong oras mauubos yan, ano yung susunod na kapalit. Okay? So, after that one, you can return to your patient after maybe 30 minutes. Okay? After 30 minutes, you may now return to your patient para check mo ulit for the backflow. Okay? Then ask the patient if he or she is experiencing any pain or kaya naman discomfort that are related to the IV infusion. Kasi kung meron diyang pananakit, merong masakit, may pamamaga, okay, could be phlebitis or pwede rin naman na nagkakaroon ng leakage or anything. So you have to evaluate your patient, re-evaluation. Okay? So yeah, that's it. For the real person, I do not know kung meron akong mahahatak mamaya na CI na kung saan pwede kong gawin itong IV cannulation, pero kung wala tayong magagawa dun. Okay, that concludes everything, guys. Okay, so this will be your final return demonstration. Okay, so I hope you've learned something. That concludes everything, so bye for now. Okay, have you Sir Denver with me? He'll perform the IV cannulation to me. May ka nga dyan. ang
Nakaka-delete.
kala ko ikaw ay kakanulate.
Ay, sumususit pa. Magpakalit.
So there are different ways para mapadilate natin yung blood vessels pero visible naman dito. So Sir Mark
Pwedeng
yeah, below the heart level,
Pero-
close open, or pwede rin namang itap-tap, di ba? I like the sound. Ayan, pwede rin naman by eyes. Pwede rin naman by palpation. So since very visible naman, ayan, madaling nakikita ni Sir Denver yung ugat. Ay, oo ano. Wait, andito pala Sir Kim. Ayan, para mas madaling makita ninyo yung yung pagkakanalate. And then makikita nyo rin dito yung flashback. Sir, pakita mo yung flashback. Pwedeng below the heart level, open and close the arms. Yan. So that is also one of the reason kung bakit naglalagay tayo ng tourniquet or tourniquet.
Hindi ko lang ilaw.
So, ayan.
Sir, tusok na ako.
Sige po sir, go ahead. So as you can see, mayroong backflow dun ng sa may flashback chamber natin. Ayun, second backflow yun sa may lumen.
Okay na, iyan ka na.
Ay, ito gamitin natin. Do you know how to use?
Di.
Ito lang.